I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Once again, this is Dr. Jonathan Lebowitz at the Long Island Gynecomastia Center, Long Island Vaser Lipo Center. So on this young man, he's 28. About a year ago, we did gynecomastia surgery on him. We did Vaser, high definition, lipo, and gland removal. The scars heal up pretty good, but he complains that he still's got some fat and maybe some glands or maybe some scar tissue right there. I'm always improving what I'm doing, always. Every day, every month, every week, I'm doing something different, something better to improve the results. So lately what I've been doing is scooping out more of the gland and fat over here to give a better definition right over here. That's been what I've been doing lately. His incision is over here. Lately, within the year, I've been doing the incision right here. He had the lipo over here in the past, so that's my new technique, my stealth incision. But what we're going to do is a touch-up right over here. We're going to, through the incision in the armpit, we're going to just kind of Vaser, melt the fat, melt the gland, melt the scar tissue, and maybe go back in here and really scope that out nicely. And touch-ups are free. I do not charge for touch-ups. And again, on this side too, we're going to melt that scar tissue, melt that gland that might be there, melt the fat that might be there through the stealth incision again, and concentrate right there. A touch-up, no charge, and get this done perfectly. All under local anesthesia. So in a minute, we're going to mark them, we're going to numb them, get them to the OR, and do our thing. Because I have newer techniques and newer styles of doing things. And if anybody says to me, "Can you hit me again over here?" I go, "No problem." They butter. To scrape the lateral aspect of the pec muscle and the rib cage. So now the Power X. Again, hugging that chest wall to really define this area perfectly. This is my grater, since I'm not going to undo his nipple again, for fear that it's going to create more scar tissue, and he really doesn't have any gland, just scar.
Yeah, it was pretty much different.
Yeah.
A whole different lot of techniques. Everything was easy. Everything was comfortable.
So once again, this is Dr. Jonathan Lebowitz at the Long Island Gynecomastia Center, Long Island Vaser Lipo Center. So this gentleman, we did it last year when I first started using the Vaser machine. But listen, literally, I'm quantum leap superior than what I was in November. So he had some shape that he really did not like, or wasn't up to his standard. He had good results, but he wanted better results. And so he came to me, I don't know, 2 months ago and said, "Doc, can you touch me up. I go, no problem. So here we are. We just did a touch-up with my newer technology, my Power X, my curved cannulas, my graded cannula, and now I do differently where I scoop out this to a much higher degree to get that wonderful stock hockey stick boomerang shape. He's still swollen here. I put over 2 liters of fluid on him, and we just did a wonderful job. There's quantum leap difference in the technique that I use. We got over about 800 cc's of fat out of them, really mainly laterally and inferiorly to the nipple. No incision by the nipple because look, there's no gland here. There's nothing, and so why produce scar tissue unnecessarily? Take this off in 24 hours or so. He could shower, and I'll see him for a follow-up and make sure that everything is perfect.